Now, if you thought gender indoctrination happening behind your back was bad enough, well, wait until you hear this next story. Documents obtained by Parents Defending Education reveal that certain Seattle public schools offer so-called gender reaffirming care on site at the schools to students as young as 11 years old. Now, one of those schools, Meany Middle School, reveals right on its school's website that this, quote, health center is conveniently located across from the school's main office. And as you can see here, one of the medical services provided at no cost includes, again, so-called gender-affirming care. So how's this all paid for? Well, partially by Seattle taxpayers who voted for this investment back in 2018. But they're also supported by something called the Country Doctor Community Health Centers. Well, on their website, the Country Doctor explains that it was founded by the Black Panthers in conjunction with the Seattle Liberation Front. It describes itself in its mission as helping the underserved access health care. How sick. Joining me now, Nicole Neily, founder and president of Parents Defending Education, the organization responsible for bringing this shocking story to light. Nicole, thank you for being with us tonight. Now, we reached out to the middle school, the Country Doctor, and the Seattle government. The Seattle Public School District did respond on the school's behalf, saying, in part, access to these services enables the early intervention, prevention, and treatment of health-related barriers to learning with the goal of promoting school attendance and improved academic performance. How is gender, quote, affirming care improving academic performance?
Well, this is something that America's families need to know is being pushed at all levels of education. It's something that certainly it's happening in Seattle, but should worry families around the country. We have found programs like this in California, and certainly it's taking place in other schools as well, because this is a priority of organizations like teachers unions, Randy Weingarten, that believe that community schools, putting health centers into schools, providing things from dental service, mental health care, to these reproductive services, gender affirming cares. It takes a burden off families. And again, underserved families, poor families, minority families that, you know, it's easier for mom and dad to not take time off of work. So we'll just do it all in the school. But again, this is done behind closed doors and families have no idea what is happening to them. And for this to be done to our children with our tax dollars is truly insult to injury.
Now, our producer, Nicole, went on that Meany Middle School Health Center webpage and dug into the registration form for students to receive these health services. And she was shocked to find out that not only can students receive and access this, quote, affirming care that they can register for, they can also get birth control, pregnancy, and abortion services at any age. And then our producer went to submit the form he noticed that only one signature was required to register for this health care. And in Washington State, minors, we know, can get abortion and abortion-related services at any age without any consent of any authorized adult. Nicole, I don't think Americans watching this program tonight, watching The Angle, have any idea this is happening.
No, the medical age of consent in Washington State is 13. In California, it's 12. And as we watch some of these abortion bills work their way through the states in the wake of the Dobbs decision, this is something that abortion activists are pushing at the state level, where they're trying to do this under the guise of empowering children. We don't want children to have STDs, to get pregnant, but then also at the same time, it is stripping away parental notification, parental care. And so a parent could come home and find their daughter bleeding out on the bathroom floor, not have any idea why or how it came to this, and then not be able to access the medical records to figure out what the heck is going on. It's interfering with our right to raise our children, to make medical decisions for them, and to keep them safe. It is appalling that this is being done in public schools.
Nicole, thank you for bringing this to light. We really appreciate it.